So Hirsch, in the past, your center has had a focus on diversity, but you've recently changed to a focus on health equity. So what brought that about?
I think the principles of health equity were always embedded in our values, and we were always working towards them, but we did not have an explicit policy directive on health equity. We had a policy directive on diversity, which I had to report on to the board in terms of what languages we had and the groups that we met in terms of our client populations. But what the health equity policy does is pushes us to think about innovative approaches to try to reduce barriers for those who are experiencing inequities, oppression due to race, due to age, due to their disability, ability, all of those. So we've made a very conscious choice of moving towards a health equity policy.
And is there a relationship in your mind between the desire to have a focus on diversity and on health equity? There seems to be a bit of an overlap there.
So we think of equity as an overall arching umbrella. I think diversity was a softer
right.
and did not really include all of the elements of equity. So it's bigger than diversity.
Right. And how has that gone over with your board, with the staff, with the volunteers?
The board was right on it, right from the beginning. As I said, we have our organizational value statements. They really speak to equity issues, recognizing that people face systemic barriers, recognizing that our role as a CHC, working from the CHC premise and as an organization, it is to help be a forum to express our democratic values, be a forum to make change happen. So we are not just a health service provider, we are a change agent. There are elements of social justice and entitlement for health embedded in our vision statement. Our vision statement states, rooted in community, strengthened by learning, we are leaders and partners for everyone's right to health, and that really speaks to us.
But the sort of health equity is a really nice way of crystallizing
all of those. It's we just did a workshop today here on role of community governance on pursuing health equity agenda. We may not have used those two words together before. We've always used the equity word in our conversation, but health equity becomes a nice measurable way whether or not your equity strategies are working. What is your outcome?
Okay, thank you very much.
Thank you.